This is a great question, and I'm going to tell you the main two reasons why people request troponins with normal ECGs or in people who have no chest pain. It's 2025, I'm a cardiologist, and I'm here to help you with your basic cardiology questions. Now, let's go back to the reason why people take troponin levels with no chest pain and normal ECGs. The first point is to remember that anyone with an acute coronary syndrome doesn't necessarily have ischemic changes on their ECG. So even if you don't have any ischemia on your ECG, that doesn't mean that the patient in front of you is not experiencing an acute coronary syndrome. So that's an important point to remember. The second point is that chest pain doesn't feature in everyone with an acute coronary syndrome. For example, in people with diabetes, they may present with abdominal pain or even lower back pain, and that can actually manifest as an acute coronary syndrome. We know in women who present differently to men, they don't have the classical symptoms of chest pain, such as a dull sensation in the center of their chest or a squeezing sensation. They often have nausea, vomiting, and more of the diaphoretic symptoms rather than chest pain. So that is why most people take a troponin level with non-specific changes when they're concerned about someone who has an acute coronary syndrome. And this might be because they have significant risk factors such as diabetes, hypertension, high cholesterol, or they've got a family history of coronary artery disease, and this is something that they want to rule out. So I hope that helps you. But on the flip side, for a cardiologist, not everyone needs a troponin, and so we get asked to see many people who have elevated troponins that are taken in the wrong context, and it's really important to correlate clinically why you're taking the troponin. It should be a test that you take for a reason rather than you take just to add to your relevant tests and to a whole range of blood tests that you're taking for the patient in front of you. There should be a reason, and you should know what to do if the patient has an elevated troponin. If someone has significant GI bleeding, their troponin is going to be elevated. If they've come in with an acute subarachnoid hemorrhage, their troponin will be elevated. So it's about thinking about the clinical context and interpreting the troponin levels correctly. I will see you in the next video. Let me know if you have any more questions.